Cosmetic dentistry is a high-stakes, highly visible investment. When you walk into a clinic in Muscat for a smile makeover, you are making a decision you'll wear on your face every day for the next decade. Despite the flawless marketing photos you see online, choosing a veneer is a major financial and biological commitment. It requires altering your natural anatomy. This checklist highlights what a veneer is engineered to fix: a thin shell that masks minor chips, small gaps, and severe staining. But notice the red crosses. A veneer is purely aesthetic. It cannot correct a misaligned bite, replace missing teeth, or stop gum disease. Placing a cosmetic shell over active dental disease guarantees a wasted investment. The veneer will eventually fail, and you risk losing the natural tooth underneath entirely. Those foundational issues require orthodontics or periodontal treatment first. If your mouth is healthy and you qualify for the procedure, you land at the exact same fork in the road as nearly every other patient, choosing between a lab-made porcelain veneer or a chairside composite resin. The decision here isn't about which material is objectively superior. It comes down to correctly matching the material to your specific timeline, your budget, and your personal tolerance for permanent dental alteration. Porcelain veneers are fabricated far away from the actual dental chair. They are crafted in high-end dental laboratories by dedicated ceramists. But to fit that porcelain onto your smile, this cross-section shows the biological cost. The dentist performs enamel reduction, permanently shaving off 0.3 to 0.5 millimeters of the outer layer. Once that natural enamel is gone, it is gone forever. That tooth will require a crown or veneer to function correctly for life. After the tooth is prepped, you will wear temporary veneers for 1 to 2 weeks. During this time, the lab ceramist hand layers your final porcelain shells, matching the exact translucency of real enamel before firing them in a kiln. The massive benefit of this kiln-fired glass is an impervious surface. Your morning coffee, tea, and tobacco habits will bounce right off. It holds its exact color and shape for 10 to 15 years. That longevity carries a heavy upfront price tag. In Muscat, a single porcelain veneer runs between 90 and 160 OMR. A full upper smile set usually lands between 600 and 1200 OMR. And porcelain has one critical vulnerability. If you bite down on an almond 5 years from now and crack a shell, it cannot be patched. You have to pay to replace the entire veneer. Porcelain requires you to trade a layer of your natural enamel and a large upfront sum in exchange for a decade of zero maintenance durability. Now we shift back to the dental chair. Composite resin is the fast, immediate alternative. This method completely bypasses the laboratory. Your dentist applies a tooth-colored resin directly to your teeth, sculpting the shape and perfecting the bite freehand in a single appointment. This side-by-side reveals the massive biological advantage of composite. The tooth on the left receives the resin coating, with minimal to zero permanent enamel removal, keeping the structure entirely intact. The risk of skipping the lab, however, is that your final smile is entirely dependent on the specific artistic skill and the mood of the dentist holding the tools that day. Because it requires only one visit and no lab fees, this approach costs a fraction. A full smile set of composite in Muscat typically ranges from 150 to 320 OMR. The trade-off for that lower price is chemical. Layered dental resin is significantly softer and more porous than kiln-fired ceramic. Over a 4 to 8 year lifespan, that softer surface will absorb coffee stains and is prone to microchipping. You will need to return to the clinic every couple of years for a professional repolish to keep the edges looking sharp. Composite gives up long-term durability, but in return, it delivers speed, affordability, and the preservation of your natural tooth. When you sit in the consultation chair with a deadline looming, the pressure to choose the right material can feel paralyzing. Let's use this decision tree to break the dilemma down, starting with the constraint of time. If you are getting married in 10 days or have an imminent job interview, the 2-week lab delay for porcelain rules it out immediately. Composite is your only realistic logistical choice. Next is the fear of permanently altering healthy teeth or strict budget limitations. If you are highly risk-averse regarding the drill, or you want to keep your initial costs low, composite allows you to improve your smile safely without passing the point of no return. The final constraint is a desire for maximum longevity with minimal daily maintenance. If you want to invest once and have bright, stain-free teeth for the next decade without booking touch-up appointments, Porcelain is the clear route. You don't need a dental degree to choose a material. You just need to identify your strictest personal boundary regarding your calendar, or your wallet, or your enamel. There is one more scenario. You want the pristine look of porcelain, but the thought of permanent enamel reduction stops you from booking the appointment. This timeline illustrates a formalized path in modern dentistry. The composite first, porcelain later, two-stage strategy. You start with composite. This acts as a trial run, letting you test drive a brand new smile shape and shade for a few years, entirely drill-free. Once you are completely confident in the look, you authorize the enamel cuts and upgrade to permanent porcelain. The financial reality here is unavoidable. This path means paying for your smile twice over a longer horizon. Ultimately, do not let a clinic push you toward a specific material simply because it carries a higher profit margin for them. Walk into your consultation with a clear photo of your goals, a strict timeline, and demand to see the dentist's actual portfolio of past patients in both materials. A successful smile makeover isn't about buying the most expensive ceramic on the menu. It is about strategically matching the biological reality of the material to your actual life plan.